Is our answer to Dr. Fauci. We do have an order in for bobbleheads for Dr. Kavanagh. They just haven't arrived yet, Doc. Good morning.
Good morning, sir. Thank you.
Waiting for the bobbleheads. Dr. Kavanagh is a retired physician from Somerset, Kentucky, founder of an organization called Health Watch USA. What do you guys do?
Well, we're a nonprofit organization that specializes in patient advocacy, but also in infectious disease and research integrity. And over the past decade, we've published a number of articles, have held conferences, and talked to a lot of the national and international policymakers. And so we're very interested in what's going on now with this pandemic and what our response has been.
Well, this is definitely in your wheelhouse. So the big thing today, of course, is more things are opening, specifically restaurants, not only here but across the state. And you were indicating that with the reopening and masks and all that, there will probably be demonstrations, and that will probably spread the virus even more. Talk about that.
Well, I think, yes, I have heard there's another planned demonstration, and we need to really remember that when you're demonstrating, the virus doesn't care. It's best to still wear masks and to socially distance. It's not saying not to demonstrate. That's our right as an American, but we need to do it responsibly. And also, if you're traveling long distances or traveling between states to demonstrate, that's just a setup to really spread the virus. And that to me is, is scary. I'm more scared of sometimes the way people are acting than the virus itself.
I got a Ken, who's a regular listener, and he's a UPS pilot, flies all over the world. And I got a text from him this morning. He says he's in Germany today, and he says it's opened up, but masks are required inside of public spaces, 1.5 meter spacing also, that's 6 feet. Mobs of folks are out shopping. The demand for shopping is evident by the large amounts of shopping bags I see folks carrying. They are contract tracing over here. If you dine in or sit outside at a table, they require him to fill out a form with his name and contact information. And nice to see the normalcy over here and hopefully coming to our country very soon. And he says at the end, by the way, for those listening in Louisville, 1.5 meters is approximately 6 feet. So that's going to be us in, I guess, a few weeks.
That's correct. And we need to do it responsibly. One of the things that disturbs me is that there's a segment of the population that just wants to return to normal. And I don't think we can do that. I think we can return to a new normal and to be responsible in how we open up our economy. If we just return to normal, we do risk having this virus come back again in the fall, and maybe even greater than what we're seeing it now. So we have to be responsible. One of the things when I've read about Sweden that really impressed me is that a lot of their mandates aren't really mandates. They're voluntary suggestions. And for example, when they told the public you need to decrease travel, 90% of the population decreased their travel over the Easter holiday. And in the United States, it's hard to get 90% to agree on anything. So we really do need to come together as a nation, and let's reopen the economy safely.
I agree. Here's another text on our Auto Text Service text line that says, if you go outside for a long walk around the neighborhood and you don't come in close contact with anyone, do you need to take a shower when you return home? And should you do this if you are in a building where there are lots of people, such as a grocery store?
Well, unfortunately, if you're covered head to toe with a virus and you take a shower, it probably is not going to do a whole lot, but it's not a bad idea. I mean, there's no downside in taking a shower. There's obviously no studies or evidence stating that you have to do it. So if you want to be on the extreme side of cautious, taking a shower is probably a good idea. Now, saying that, I'll admit to you that I've done that before. If you get in an area that you think is dangerous or someone's not social distancing, I'll come home and I'll take a shower, get my clothes off and throw it in a hamper. So I guess the answer to that is we don't know for sure, but it doesn't sound unreasonable.
And I don't think wearing a mask in public is unreasonable, but apparently a lot of Americans do, and I don't understand it because it's not that big a deal. Is it hard-headedness and not wanting to be told what to do, or what do you think that's about?
Well, I think there's some of that. Not being told what to do is kind of viewed by many people as an affront to their personal freedom. I think it's a lack of understanding and trust of the science that's behind this. I think it also has to do with a lot of mixed messaging that we're hearing. You know, originally the Surgeon General said, don't wear a mask, they won't do any good. Yep. Then they're saying, wear masks. And you see our leaders, some wear masks, some don't. So that confuses the public. But to at least clear some of it up, in the beginning when we had advisements to not wear masks, that was because we did not know about this asymptomatic spread. Remember, the mask isn't to prevent you from getting the virus so much as preventing an asymptomatic carrier from spreading the virus to other people. And asymptomatic carriage may be somewhere around 50% of the cases are due to asymptomatic carriers. So that's the reason for wearing a mask. And it is effective in preventing a carrier from spreading the virus to another person. Now, is it 100% effective? Well, of course not. But it does decrease the chances. And there's some modeling which suggests that if 80 to 90% of the people wore masks, that we would have a significant decrease in the severity of this pandemic. So wearing a mask, I think, is of utmost importance. And that's one of the things that will not only protect other people, but it'll protect the employees and also the financial viability of the retailer. Because I do not want to go into a retail establishment where someone is breathing all over the items that you're going to pick up. They may be coughing or sneezing. I just don't want to go in there if someone's not wearing a mask. So it will help the economy and help to reopen our economy. So do it out of respect for others. It's not a safety thing for yourself. It's more of a respect for others.
Now, we found out yesterday through some scientific study that transmission of this virus not so much on surfaces as we thought. I know you said that you wipe down all your groceries and leave it in the garage and all that business. It sounds like now that may not be necessary. What do you think?
No, I would still do it. I'm not sure what not so much means. I mean, that's the problem here. When you get into this part of an epidemic where things are really starting to mount up, sometimes the messaging tends to mitigate the severity or lessen the severity of the danger that's out there. I'm not saying that's what's taking place, but the studies on viral transmission are the same. If someone picks up a virus from a grocery pack, you're not going to have a cluster of events. It's highly unlikely it's going to be just one person getting it from that grocery pack. And so it may not be picked up epidemiologically, and they may not even figure out that's where you got it from. So I would still be careful with that. And remember, the virus, as a rule of thumb, will live on inanimate objects or environmental objects for about 3 days. And that's indoors in a warm setting. If it's outdoors under the sun, you're talking minutes there in the sun-exposed surfaces. So I still do that with groceries. I think that that's important, just to be on the safe side. There's no downside to doing it. And again, we use soap and water. I think it would be a waste of disinfectant if you've got soap and water there, because remember, the virus is a grease ball, and there is some evidence, and at least theoretically, that the soap may actually kill the virus because it will dissolve the lipid protein coating it has on the outside.
Okay. Let's go to the phone. This is David. Hey, David, good morning.
Hi, Jack. I would just like to say that why we're confused is because, we have new information saying it doesn't live on surfaces. Now here your guest is saying, oh, blah, 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 it does live on surfaces. it's getting to the point where everyone just has an opinion. Your opinion, sir, sounds just as novel as this whole thing, and we know plenty about viruses, and this is no different. This has the same properties, and frankly, I just think that, we need to reopen society. The immune compromised and those that are chicken littles need to stay inside and let us all go about our business. And, sir, you're just scaring people, okay? Now, either keep up with the current knowledge that's been passed along by science or, stand aside. And thank you. Have a good day.
I don't know what he's talking about.
Well, I'm not either. I don't think we've ever said not to reopen society. We've said to open it up safely. And the current knowledge, there is a lot of studies looking at how long viruses live on surfaces. And it's up to 3 days. So I really think that we need to look at the science. You can't have talking points and make the virus go away. And this is similar to other viruses, as the caller said.
Brought to you by the CDC and the Ad Council.
Text now about you're mentioning that you would still be careful with surfaces. That's what I asked you. That's what you said. But let me say what the science says and what the CDC says. Changing its coronavirus guidelines, saying infections are more likely to come from people than surfaces, not are totally coming from people rather than surfaces. More likely, new research suggests the virus does not spread easily from surfaces, although the CDC still recommends washing your hands, sanitizing regularly, all that stuff just as before. However, the virus spreads very easily and sustainably between people through respiratory droplets spread by coughing, sneezing, talking, etc. So the point is people hear what they want to hear, and so the CDC is not saying you don't have to worry about surfaces anymore. And that's what everybody's saying. They're saying the CDC has said don't worry about surfaces anymore. They didn't say that.
No, they didn't say that. And as I've said before, I may have misspoke. I want to make clear that the viruses can live on surfaces for up to 3 days. There's one study that I saw that said on glass can be 4 days, but you're talking about days. Cardboard could be 1 day. So yes, the CDC did not say it's safe. They said that mostly it's spread between people. And it kind of makes sense because I contact people a lot more than I contact surfaces when I go out and I'm walking around. And of course, I try to avoid people by staying at least 6 feet or greater away, but it makes sense. It doesn't mean that surfaces are safe. I don't think you should take that as the take-home message from what the CDC stated.
Good morning, Dr. Jack. How are you guys doing?
Yeah, I'm not a doctor, sir.
I said Dr. and Jack.
Oh, okay, good. I thought you said Dr. Jack.
Dr. and Jack?
Yeah, good. Doing fine.
I just want to throw something out there at you guys. So everybody keeps talking about the economy. There's roughly around 330 million people in the United States. 30 million or so, give or take, a little more on unemployment. They say out of that 330 million, around 100 million are 21 years and under. So that leaves, and a lot of them 100 million 21 under are still working and have been working. So that leaves around 200 million people in the United States still going at it every day. It has been going at it every day for this whole entire pandemic. Your thoughts?
Well, I think that you've got to be careful from just looking at death rates. This is a virus that's very dangerous. It affects the lungs, it affects the liver, it affects the heart, it affects the kidneys, it affects the central nervous system, it affects the GI tract. It is not the flu. And the younger people can still get extremely sick, so they too need to be careful. When they go back to work, they need to take precautions and they need to protect themselves. The other thing which we are worried about is that this is an RNA virus. It is mutating. There's already one mutant variant that affects the spiky portion, that little attachment spike on the virus. And it's possible, similar to the flu, that you may see another strain or another version of the virus come out that would require a vaccine being modified.
Doctor, I'm out of time. I'll talk to you next Wednesday, okay?